So we were in a, and still continue to be in a rapid growth phase, and our outstanding patient balances were just simply growing, and didn't want to just keep adding bodies to collect dollars. It was easier to find a platform that worked to do that for us. Secondly, I'm a firm believer, and we do use a lot of our marketing is text-driven, and your platform offered that capability, and I think we really have benefited from that. Our age demographic patient is kind of in that age group that is, smartphone's not an unfamiliar device, and it just makes it very easy for us to get paid. I think the first year we collected a little over $1 million with your platform. Our revenue cycle team, while our growth, which is volume growth, increased pretty dramatically, our revenue cycle team decreased by a person.
Wow.
That wasn't the original goal.
Right.
It was not to lose somebody because you made it that possible, but it is one of the things that came about.
Right.
And just the functionality, the way there's easy interface with Athena, the ability to set up payment plans, just the ability to somebody pay their bill 7 days a week as opposed to just when we're open. I think we just found very beneficial. So we have always, right or wrong, we've always had the first option on our auto attendant to be press 1 to pay your bill. And that works great if it's Monday through Friday between 8 and 4:30, and there's somebody available in billing to answer the phone.
Right.
That's not always the case. They're all doing things, they're on the phone already. So we end up in this constant voicemail tag back and forth with the patient trying to collect some outstanding balance. The addition of the IVR allowed us to add the option, press 1 to pay your bill, and then once you press 1, you have two options: either speak to a person during regular hours or have that text sent to you to pay your bill. And it certainly is a growing number each month. I think people are very comfortable, receiving a text and paying their outstanding balance. Well, so first, again, the intent was not to make our team smaller,
Right.
but we lost a head count, which there was immediate cost savings there. We did a case study, which I think is on RiviaHealth.com, that showed that in the first year we believe we reduced 389 work hours across the billing team by utilizing your platform for text collection.
Awesome. Yeah. Love saving that time. 389 hours a month.
I can say in complete transparency that it was by far the simplest interface we've ever done with Athena. We signed whatever the authorization documentation is from the marketplace, and sent that over, and in a week and a half, we were up and running. We didn't have scheduled calls with timeline and deliverables and have to bring in an IT resource. It was painless. It went from we agreed to do it, signed an agreement, and it was up and running. It's been running fine ever since. In my role and others on our team, we're all busy. We have a lot to do. You don't want to bring on any platform that's going to make it more complex, more time-consuming, more challenging. And Rivia has really just been, it was easy from the start, and it's been seamless ever since.
Thank you. I'm so glad to hear that. That's what we like to hear.
The IVR piece, I think, because it's new and unique in the market.
Yeah.
It is growing. If we just saw it plateau with a level number every month, I wouldn't be as excited. But I like to see where that can continue to grow and be a bigger part of what we do. Well, I know what our decision process was. I can only speak to that. Athena does a lot of things well. We just felt at the time that the communication piece outside of paper statements was less than 100%. I know there are others looking in this space now, but you were really kind of first to it, in my opinion. Certainly with the text message capability, which was the important piece to me. I would just, again, look at how simple it is to be up and running, the value in what dollars are collected without really doing anything. And the fact that we talk about innovation. We don't talk about service disruption or failures or why are we down or why is this functionality not where it should be. And that we don't have that same luxury with some of our other marketplace partners. Anything that can make a busy person in any healthcare operation, anything that can make their job easier, simpler, take one more worry off their plate, I think is advantageous. I would offer that, and we're guilty of it ourselves. We do a certain thing a certain way because we've always done it that way. And things like Rivia, things like the IVR with the phone system, that we would not have really gone down that path without, kind of looking into how we can improve, is important. So I think My recommendation to anybody in any market space really would be, this is a very low cost add to enhancing your revenue team without having a permanent head count, and I just give it my highest recommendation.